So we've come to speak to you today about the changes we made in our service. My first declaration is I'm not a public speaker. I've been coerced up here. I'm usually like 12 primary school teachers is my limit, so I just want to look at you. So a little bit about where we come from. We work for Cwmtaf University Health Board. We serve around about 300,000 people living in Merthyr Tydfil and Rhondda and Taff. Our health board comprises of 2 district generals, Prince Charles Hospital in Merthyr, where myself and Vicky work, and the Royal Glamorgan in Llantrysnt. There's a number of community general hospitals as well, but myself and Vicky both work out of Prince Charles. Each district general has got an adult diabetes centre and a paediatric diabetes clinic. There's approximately 170 children with type 1 across the health board and just 3 with type 2. Of the 90 children up in Prince Charles, on the deprivation score, we score the most deprived and the second most deprived, that we only fit those boxes. So there's approximately 1,350 adults with type 1 diabetes in primary and secondary care. So a little bit about the history of transition services at PCH. Prior to 2005, our children were actually looked after by adult DSNs. There was a paediatrician and there was 1 clinic a month, and that was pretty much the only care they had. There was no community follow-up. It was purely just those clinics. Transition, there wasn't really a transition. The young people were handed over by letter. When we've looked back through the sort of last years, there was no set age. Most went at about 16, but there was, you'd see some children would just be handed over because they didn't attend clinic. Some children would be handed over because there was words in clinic between the child and the consultant. So there was nothing really set in stone, and as I said, it just was a letter, and all of a sudden they went from our clinic to the adult service. So back in 2005, I was employed as a PDSN, and that's when the diabetes team started to be established. We still only had 1 clinic a month, and we still only had dietetic input in that clinic. So over the next few years, we sort of tried to develop the service as much as possible, with obviously the child and the young person at the forefront. So in 2008, we looked and thought something needs to be done about transition. So we tried a nurse-led approach where myself and the adult DSN saw the young people in a joint clinic. They were still handed over by letter from the paediatrician to the adult consultant, and it didn't really work because we had a different adult DSN in every clinic, so no sort of relationship was established. So in 2012, the consultants decided they'd have a go. We as nurses supported the clinic, but no dietitians, but they stopped the nurse-led clinics, and I think this is where we went wrong. Adult services couldn't let the adult DSN attend both nurse-led and consultant-led because of the fact there wasn't many of them and not enough hours. So things didn't improve, and in 2016 it just got to the point where we could see there was high DNAs in transition clinic, there was high DNAs when they went over into adult services, and the verbal feedback we had was dreadful. And also it almost felt like the young people transitioned to adult services, but they still felt like they were on my caseload. I'd still get the telephone calls, out of hours especially, so it was like, we need to do something. So we got together as a team and we invited Sarah along to help thrash it out because we knew it wasn't going to be easy. So some of the verbal feedback, you've probably all encountered exactly the same things. In paediatrics, we'd done point of care, HbA1cs. In adults, it was a visit before clinic for venous bloods. We had open access in peds, they had to visit A&E. We had out of hours, we had mobile phones that we answered, and suddenly they had this 9 to 4 answer phone in adults. We held clinics anywhere and everywhere. Adult services only held them in the main district general. There was no sort of follow-up in schools and colleges, And this one is quite interesting. They said our waiting room in paediatrics was comfortable and informative, and in adults it was dark, bland, and they waited with podiatry patients. The only informative part of our waiting room was the telly which played Disney films, so I think that's what they like more than anything. So we started by looking back at our 7 years previous transition patients. We sent out surveys to the young person and the parents. I think we sent 40 odd back, and we sent 40 odd out and we had about 20 odd back. We asked one question on there, was on a scale of 1 to 10, how prepared did you feel to move to adult services? The young people, 90% scored 5 or less, and when we asked the parents the same question, 100% scored 3 or under. And like some of the comments you can see, one parent said we felt totally out of our comfort zone, completely lost as a parent and unsupported. And that was probably on the feedback from, we'd sometimes sit in a clinic, we'd talk about the next appointment with adult services, and the parents say, I can't get to this hospital, I work in so-and-so. And the consultant say, well, you don't need to come anymore, he's an adult now, and you could see the horror on these parents' faces. And some of the other comments were about times between clinics. We used to see children really frequently in paediatrics, and that was sort of stretched into adult services. They'd sometimes go months without seeing anybody. So in January 2017, we established our new service after many fights, many arguments, and we got there. So at around about 16 years of age, the young person enters Transition 1, and that's based in the Paediatric Centre, and it's led by myself with the adult DSN and the Paediatric Dietitian. They're invited to 3 nurse-led sessions throughout the year of their 16th year, and leading up to 17, they attend and had a transition clinic with a consultant. It's led by the paediatrician, but the actual adult consultant is there, the adult DSN, myself, and the adult dietitian. Throughout that 17th year, they then attend 2 nurse-led clinics, and that's in the actual adult diabetes centre, and it's led by the DSN. I'm present, and also the adult dietitian. And then around their 18th birthday, they come and attend the second consultant-led clinic, and that's led by the adult consultant. And again, we're all there, and that's when, if everybody's in agreement, that young person is handed over into the care of the adults.
So what we look to cover in the transition clinics is, rather than just focusing straight on what are your blood glucose levels, let's download your pump, which is pretty much how it used to be, is trying to actually get to know the young adult and their parents as well, and they get to know us. So a lot of the time in the first appointment, we don't really mention much about diabetes at all, we don't download their pump, we don't look at their blood glucose levels, it's just trying to find out more about them. Obviously, if they have any concerns because they're having loads of hypos, we'll still obviously look at their diabetes care as well, but that's not the focus on it, which it used to very much be the focus of it. So it's them getting to know us and us getting to know the young adults and their families. We try and educate them, the young adults, throughout the 2-year period as well. Things that we look at, things like hypos, sick day rules, carb counting, driving, sex, drugs, rock and roll. Also what happens next. So it's very much what's going to happen when you go into the adult service, when are the clinics, how often are clinics, who are the contact details, just they know who and what's going to happen afterwards, what structured education programs are available, and they've got what their options are. We made quite a lot of changes to the environment and to information, because before they didn't really get any information leaflets. Whereas now at the start of the transition process, they're given a leaflet to explain the transition process. And then towards the end of them coming over to adults, again, they're given a leaflet on who's who, contact details, when the clinics are, what hospital sites the clinics are, so they've got more information. And because they said our waiting room was bland and not very inviting, we've tried to brighten it up a bit. So we've got like displays on like hypos, we've got like other information on the walls. We've also got a meet the team board, which looks like that, so they can actually see who we are. It's got everybody in the diabetes centre, our faces and what our jobs are and what we do, so at least they're familiar with who's who. And a lot of like adult patients have found this really useful as well, so at least they can put a name to the faces. So we've also looked at transition performers as well, so we've looked at the paperwork that we're going to do in each of the clinics. So it was a lot of sheets of paper, which we are going to be changing again, but at least we had like information on what we've covered in each clinic that then can go in the notes at the end. We've also looked at trying to do additional clinics on other sites at some of the community hospitals. So the main consultant clinics are still just held at the main acute hospital site at Prince Charles Hospital. But myself and the adult DSNs does a clinic in the other community hospitals. So in between the consultant appointments, they can see us at their local hospitals. They don't have to travel as much. So that's everybody who's in our young adult team. So we've got the paediatrician, which is Dr. Humphrey, name I can never pronounce, Okwangi. We've got Lucy, we've got the paediatric dietitian Matthew, and the adult diabetologist is Dr. Daz, and the main DSN is Beth Mumford, and then myself. There's obviously other people in the team, but we're trying to keep it consistent. So they see the same dietitian, same adult nurse, so again they actually get to know the team rather than seeing lots of different diabetes nurses. A lot of people concerned is like, is this an awful lot of extra work? How do you manage with the same number of staff in? A lot of the transition clinics where the DSN and the PDSN and the dietitian used to meet anyway were just converted to transition clinics. So in terms of actual caseload for the PDSN and the paediatric dietitian, it wasn't actually any more clinics because they were just converted because it had been seen anyway, so they were just converted to transition clinics. The person who's got the most extra clinics, I'd say, is the adult DSM because she's involved in transition 1 and transition 2. And there are a lot of extra clinics, so that's the person who's got most of the extra time. Adult dietitian myself, I've got a few extra clinics as well, but again, it's not a huge amount, it's not that you can't cope with it. And the consultants have got about 4 additional sessions per year as well, so again, it's not a massive extra to the caseload. A lot of the issues is having the time to do all the admin, so it's like we haven't got any extra admin support, so in terms of planning the dates, coordinating the clinics on who gets booked into where, that's where a lot of the time is actually taken. Could do with definitely more admin support. In terms of like survey results, we've had a handful of people who've completed 1 year of the transition process because we started it in January 2017. So we had about 8 surveys back from people who've completed at least 1 year of the transition service. And again, on the same question, the scale of 1 to 10, 10 being fully prepared, 100% of young people scored 6 or above, which was a big improvement, and 75% of the young people scored 8 or above. And in terms of the parents, 100% of them scored 7. It's only a small number because we've only had about 8 surveys, but already it's looking more positive. And one of the comments was felt anxious before transition appointments, but reassured by the support received from the adult team during transition. Somebody said they wanted more appointments if possible. Some of the questionnaires weren't given out immediately after they transitioned over. So again, we've still got issues that they have lots of appointments during transition, and then when they go to the adult services, some of them seem to get lost. So I think that's an area we're going to be addressing at. So I think they wanted more appointments when they came over rather than during that time. We'll soon be able to start getting results from the people who've done the 2 years, because we started it 2 years ago. So now we're starting to have people come through, young people coming through who've actually done the 2 years. So by the end of this year, we'll actually have more data in terms of how it's gone when we give them, because we're going to be giving them out the surveys at the end of the transition, just before they come across to adults. So by the end of the year, we'll have more data. It's obviously an ongoing process, and you realise issues as you're going along. There's a lot of young adults coming over in the next couple of years, so due to numbers, we're looking at doing some group sessions in transition 1, so rather than having all one-to-one appointments, the first one's going to be more as a group. They'll get peer support learning as well, so it'll be beneficial point of view, and for, because of numbers, that's the way we're going to be doing it. We're looking at introducing Sarah and Connect as well, and using that as part of it. The current performers we're using are just lots of sheets of paper, so we're just trying to make it into a booklet, so they just have the same booklet throughout the whole transition process. You just add into it, so it's easy to see exactly what you've covered when. In terms of, we've still got issues, they have the nice transition process, but when they come over to young adults, there's still issues with it. The majority of the young adults are on an insulin pump, so they'd all come into our insulin pump clinic, and that is MDT with myself, one of the DSNs, and the consultant. But if they're not on a pump, they were just booked into young adult clinic, which is only run by the consultant, and those clinics would often get cancelled. So if the consultant was on the hospital wards, they'd get cancelled. So they would go in months and months, and sometimes even a year without being seen. So we're trying to change that now. So we're making one of our insulin pump clinics a young adult clinic. So it's going to be the first Friday of every month now is going to be a young adult clinic, whether they're on a pump or not on a pump now. And that'll be MDT, so that'll be a better service, hopefully. And those clinics don't tend to get cancelled. Yeah, that's about it. Any questions?